Okay, I think we're going to go ahead and get started. Good morning, everyone. Thank you for joining our WASHA webinar, Insider Tips for Navigating Chronic Illness. I'm Ingrid Nielsen, Chair of the WASHA Education Committee, and my co-facilitator behind the scenes is Karen Vogel. So thanks for being here, Karen. We are so pleased to have the founder and executive director for the Center for Chronic Illness, Allison Fine, with us today to discuss the impact of chronic illness. As medical treatments improve, people are living longer. However, they often experience significant symptoms that greatly affect quality of life. And often these symptoms are invisible to others or misunderstood by loved ones. Why can't they just get better? Allison will share her compassionate approach and creative ideas for helping individuals cope and help gain more control back in their lives. Allison earned her Master of Social Work degree from the University of Kansas before moving out to Seattle in 2007, where she then became a licensed independent clinical social worker and started practice for individuals living with chronic illness, and often the family members and loved ones who support them. She has also worked in a variety of settings, including nonprofits, retirement communities, end-of-life and hospice care. Through her counseling, writing, and public speaking, Allison has provided emotional support and education for individuals impacted by a wide variety of conditions such as multiple sclerosis, Parkinson's disease, chronic fatigue syndrome, fibromyalgia, just to name a few. She has a wealth of relevant experience, both from her private practice and within her own family. And she began to see familiar patterns across many illnesses. So taking her lifelong passion for supporting those living with chronic illness and seeing the large unmet need among the staggering number of individuals and their loved ones impacted by chronic illness, she was prompted to start her nonprofit, the Center for Chronic Illness, which offers free, professionally led support groups and excellent health education programs. So before we get started, just to mention a few logistics, if you have any technical difficulties, just log in over again with your unique registration link that usually solves most issues. There are going to be question and answers at an opportunity for that at the end of Allison's talks. So please type in your questions anytime during the presentation and we will address those. There's a PDF version of the speaker slides and also a handout which includes links to relevant resources that Allison will talk about, and you can download that or print that out, but it will also be sent to you in an email. So I'm excited to get started because I know that Allison has some great information to share with you. So welcome, Allison.
Thank you so much for the warm welcome, Ingrid. So as Ingrid mentioned, I not only work as a clinical social worker in private practice, but also in 2016 started the Center for Chronic Illness, which I'll tell you about towards the end of my presentation. But Ingrid, if you move the slide forward, we can go ahead and get started. Thank you. So I wanted to share with you all a few case studies just to give you some examples of who are folks who live with chronic illness, what are their lives like, what are the kinds of things that are impacting them. So to start off, we're going to talk about Sally. So Sally's a 40-year-old woman and she's been diagnosed with chronic fatigue syndrome. She's somebody who, takes care of herself. She eats a healthy diet. She exercises. But with the challenging fatigue that she experiences with her diagnosis, she feels exhausted during the days. And then, as often the case with folks with chronic fatigue syndrome, she has difficulties sleeping during the night. So you can imagine the dynamic that this creates when somebody is just so exhausted, but then can't get a restful night's sleep to be able to recharge. Sally is somebody who used to work full-time and now unfortunately has only been able to work a part-time role. She really longs for the days before she was sick. She really had a better quality of life before she was dealing with so much fatigue. And, she also worries that, chronic fatigue syndrome is something that does not yet have disease-modifying treatments for. It doesn't have medications that will stop the illness or slow down the progression of the disease. And so she really is concerned about what's going to happen as her disease progresses. Next slide, please. So I wanted to start off talking a little bit about the numbers. So why is understanding chronic illness so important to us? I think the overwhelming number here is 117 million people are living with at least one chronic illness as of 5 years ago, and many of those individuals are living with more than one chronic illness. And so these are individuals whose lives are disrupted on a varied scale. It might just be something that doesn't disrupt their life very much, or they don't feel physically bad that often and are able to have a decent quality of life. And then on the other end of the scale, folks who are significantly disabled and are greatly impacted by living with their illness. Another pretty overwhelming number is 54 million adults live with arthritis. So arthritis is one of the most common chronic illnesses that we see here in the United States, and it's also the most common cause of disability. And I would guess that each of you probably knows someone living with arthritis. It's something that's very common, especially as folks get older. The other thing I want to mention about chronic illness is that it so often can be invisible. So somebody can be living with all kinds of things going on inside of their body or their mind, and we can be unaware of that. 27% of folks who suffer with invisible chronic illnesses have seen more than 10 doctors before they've been diagnosed. And that's pretty shocking. I think that tells us that we not only don't understand chronic illness well enough, but doctors also aren't great at diagnosing. They don't have the tools or the information yet to be able to figure these things out more quickly for people. And I've seen this as well in my own work with patients living with chronic illness. I've heard time and time again stories of folks who it took them a long time to be diagnosed and they didn't get the answers they needed, and as a result suffered for a great deal longer than maybe they should have. Okay, next slide. Thanks. So just to give you a brief overview of what is chronic illness, these are health conditions that have no known cause or cure. It's not something like the flu that you get and then will go away and you'll feel 100% again eventually. This is something that you might have medications for that help to manage symptoms, or even medications that help to manage the course of the disease, but it's never going to go away. It's something that will exist throughout this person's life. The other misconception about chronic illness is that, only older folks get chronic illness, and that's really not true. There are a lot of rare chronic illnesses that are diagnosed when people are born. And then there are chronic illnesses such as multiple sclerosis, Lyme disease, lupus, that can be diagnosed really at any age, but young adults frequently get these diagnoses. Sometimes chronic illnesses can be hereditary, sometimes not. Sometimes they're you might have heard the word autoimmune. Sometimes they're autoimmune diseases, sometimes they're not. For folks living with chronic illness, they'll go through periods of flare-ups or exacerbations. Some of them feel unwell all the time, and while others might have periods of remission. So for example, Crohn's disease is a chronic illness that for some people they're able to experience periods of remission and feel well, and it's almost as if the illness isn't there at all for some folks. I said a little bit about, invisible chronic illnesses versus visible. I'll talk about that again in a minute. The other important thing to know is that there are some cultural differences. So certain cultures have certain chronic illnesses that are more prominent for them. And so it's just important to remember that as you try to understand more about chronic illness. And next slide. So I want to talk a little bit about some of the myths that are out there in our society about chronic illness. And I think this is important to address because oftentimes I have patients come to me and they say things like, somebody said this insensitive comment to me, or somebody suggested that if I do X, Y, and Z, that I won't have my illness. And it really is hurtful and frustrating for people who live with these conditions day in and day out. And so I want to just go over a few of these. So the first one, this understanding that people who are unwell or have chronic illness have control over how they feel. And this is really not the case at all. Nobody would choose to be sick. And, if somebody had control over how they feel, I'm guessing that they would choose to feel well as much as they could. Again, it's really important to understand and to not place blame on folks who are really not feeling well. Next, I frequently hear this. This is one of my favorites. If you would just take these supplements or sleep more, if you're just not exercising enough, or even if you go to church and just pray more, you'll feel better. While some of these things might help to manage symptoms or attitude about living with chronic illness, none of these are going to take the chronic illness away. And again, when we say these kinds of things to people who are not feeling well and have no control over their chronic illness, these things can be really hurtful. Another assumption about living with chronic illness is that folks either are sick all the time, or that when they are having a good day, they shouldn't be having any fun. They should stay home and rest. And that's really not the case. We want folks with chronic illness to live the best quality of life they possibly can. And if they happen to have a good day, fantastic, all the better. And we want them to have that quality of life and soak it in, again, as much as they're able to. Oftentimes this comes up when, you see somebody, maybe a relative around the holidays, and you think, oh, they must be doing great. They look great. They look well. Common phrase in the chronic illness community is, oh, but you look so good, and so what we often don't see is the preparation that folks have to go through in order to be in social situations. And so sometimes, that aunt or even your father, somebody living with chronic illness, might have had to rest for many days in a row or do things to take care of themselves in order to be able to be present and engaged at that event. Again, another myth is chronic illness patients must be older. These are things that happen to folks as they get older, and that's really not the case. Anybody at any age can live with a chronic illness. And then finally, I think it's important to point out that living with chronic illness is really not hopeless. There's so much that we can do to help patients live more fully with chronic illness, and also, acknowledge where they're at in their diagnosis and be realistic about that, but also, encourage them to do certain things to live the best quality of life possible. And I'll go over some of those things as we move forward. Next slide. Next slide, please. So I want to talk a little bit, I'm not a doctor, so I'll put that out there, but I have worked with folks with a variety of chronic illnesses and have seen and heard about many of the physical symptoms that people experience. Symptoms that people experience physically really depends on what their diagnosis is, where it's happening in their body, and what kinds of challenges they're facing. And so people can experience anything from neurological symptoms to gastrointestinal symptoms. There can be things like joint problems, muscle aches, spasms. For example, people with epilepsy can have seizures. People with Parkinson's experience tremors sometimes. So again, really, it's important to understand, and so many of these things are invisible. So it's just important to remember that any of these things could be going on for somebody living with chronic illness at any point inside of their body. Next slide, please. So in addition to living with a lot of physical symptoms, some chronic illnesses also come along with cognitive or affective symptoms, mood symptoms. So I like this Peanuts cartoon. I'm afraid my brain has left for the day. I think that's often how folks living with cognitive symptoms of their chronic illness feel. It can feel like there's just a dark cloud weighing on their brain, or, they might notice they have difficulty problem solving or multitasking, just can't remember things. Um, for I would also mention they have cognitive fatigue sometimes. So, this can come up if somebody is working, a taxing, cognitive job, and at the end of the day, they might not have much left. They might not be able to do much in the evening, or maybe they can't even work a full day as a result of this cognitive fatigue. So, again, it's important to remember fatigue is really not just a physical symptom, but can happen for somebody mentally as well. And then affective symptoms I'll mention. So for some chronic illnesses, things like depression and anxiety are actual symptoms of the illness, and Parkinson's disease is a really good example of this, where anxiety and depression can, again, be a part of what the diagnosis is rather than just a reaction to it. And I'll talk about that a little bit more here in a couple minutes. And the last thing I'll mention here is the pseudobulbar effect. So this is something that happens for folks when they are unable to control their emotionality. So you might notice somebody is having like an inappropriate emotional reaction to something. Maybe they're crying at a time when maybe tears aren't necessarily warranted, or they're laughing inappropriately. So if you see this happening for somebody and they also have a chronic illness, it might be the case that the pseudobulbar effect is part of their diagnosis. Next slide, please. So I want to present another case study here. So this gentleman is an elderly gentleman living with Parkinson's disease. He's somebody that, again, I talked about how sometimes people don't get a diagnosis right away, and this is a good example of this. He's noticed symptoms for years, but he was just diagnosed last year. He lives with his wife, and they're in a retirement community, not an uncommon circumstance for somebody his age. But she has been noticing that he's just been more agitated recently, and he's really not enjoying things that he used to enjoy. Maybe he went down to the play cards with his friends, and now he's not wanting to do that, or he's not engaged when he does go, or doesn't go at all. And then the other thing I'll mention is that he had a friend who passed away of cancer last year. And so we'll talk in just a second about loss and complicated loss and grief, and what happens when there are multiple losses going on at a time. And my guess for this gentleman is that he's not only grieving his own diagnosis of Parkinson's and potentially dealing with some depression, but also, dealing with the loss of his friend. Okay, next slide. So grief and loss. So, typically when we think about grief and loss, we think of losing a loved one. So, we've probably all known someone in our lives who's passed away and gone through some kind of a grieving process. What is important to know about grief and loss with chronic illness is that it's a similar process. Similar emotions can arise because of the many losses that people experience in living with chronic illness. Some of these losses are because of a loss of physical functioning or cognitive functioning. Other losses have to do with, maybe somebody can't work anymore, or they're not able to live their life in the same way that they were before. Perhaps they have to give up hobbies or friends, or relationships. And so, it's important to know that these losses happen, but also that the grieving process, which is a reaction to these losses, is really a normal and healthy experience. When somebody doesn't experience loss or doesn't allow themselves to access these emotions, I tend to worry a little bit more than if I see someone having a hard time as a normal reaction to something. Um, so with chronic illness, there can be both, the feelings of grief and loss around what's happening right now. So it can be a very present experience, but it can also be something that people anticipate. So for example, if someone's diagnosed with something progressive like multiple sclerosis when they are in their 30s, it might be the case that today they don't have much of a disability. They might be somewhat symptomatic, but it's not having a huge impact on their life yet. But they may be grieving the losses that are to come in the future. And again, with something like MS, we don't know. No two illnesses are the same, and people with the same diagnosis are not experiencing the same thing. And so some of that preemptive grieving might be warranted, and some of it might not be. So that's really important to remember as well. I mentioned complex grief, so if somebody is grieving multiple losses at the same time, that can turn complex. You might be experiencing anger over one loss and sadness over another, and that can feel emotionally confusing at times. The other thing I'll mention is chronic sorrow. So I heard this term a long time ago, and I thought this made plenty of sense. With chronic illness, there's loss after loss after loss for some people, and this can lead to just feelings of chronic grief or chronic sorrow. So you see the stages of grief listed down here. The important thing to remember about these is that there's no set way that people grieve. Everybody grieves differently. Some of that's dependent on what their loss is, and some of it's dependent on how they've grieved in the past, other losses. So while some, people might be more inclined to feel angry when they go through a loss, others might be more inclined to stay in denial for quite a while or to reach acceptance more quickly. Next slide, please. So I saw this cartoon and this really resonated with what we're going to be talking about next. This gentleman says, my social life has really picked up lately with all these health clinic visits, and so often people with chronic illness can become very isolated, and I thought this was a great example of that. He's looking at his health clinic visits as a social outing, which has some humor but also some sadness to it. Next slide, please. So I want to talk a little bit about depression. So again, depression can be a symptom of some chronic illnesses, but it can also be a reaction to feeling sick for such a long time and dealing with so much adversity ongoing. So it's important to remember that regardless, it might be important to treat the depression if it becomes ongoing. For some of us, we can experience a down day here or there, and we're able to kind of bounce back and do the things that, engage us in life again or help us feel more connected or less depressed. But for folks with chronic illness, if, for example, they're not able to go out and be more social if they're feeling depressed, or if they don't have the resources to, join a club or, change their financial circumstance or, some of the other things that contribute to feeling how they're feeling, it's going to be important to look at that a little bit more closely and perhaps see a therapist, perhaps see a psychiatrist. Yeah, so you see the long list of symptoms here. So we often think of depression as sadness, people that are just not able to engage in life or are just feeling really down all the time. But there are a lot of other symptoms that come along with depression that I think are important to mention. Oftentimes we see people feeling agitated or irritable when they're depressed. And, so if you notice somebody's just been particularly nasty lately, it might not be the case that they're a bad person. It might be the case that they're struggling with something on a deeper level. Again, sleep changes, appetite changes, that can go either way. Either you're sleeping too much or eating too much or not eating enough or not sleeping enough. Oftentimes we see kind of a lack of engagement in activities people used to enjoy or just negative thought patterns. Often people who are depressed don't feel like they should be around other people. They don't feel like they're good company or that they have anything to offer, which contributes to the isolation that so many people experience when they're feeling depressed. And then finally, and most importantly, I'll mention, suicidal thoughts and actions. Some people think about ending their life when they are feeling depressed. And if you talk with somebody who is having these thoughts, it's really important to help them access the resources that can get them the help they need. And I'll talk a little bit later about what those resources are. Um, I'll mention as well there's some risk factors. So if you have a history of depression and then you've been diagnosed with a chronic illness, or you have a family history, mom, dad, sister, brother, and then you're diagnosed with a chronic illness, it might be more likely that you also would experience depression, and similarly with a history of alcohol or drug use. Next slide, please. So I want to talk as well a little bit about anxiety. So when you're diagnosed with a chronic illness, or even before you're diagnosed with a chronic illness, there can be a lot of worries. What's wrong with me? Will this ever go away? What's going to happen next? So again, anxiety can be something that is happening because we don't know what's going on, or it can be happening because we know what's happening and it's scary, or it can be a fear of what's to come in the future. So on the left side here, you see a bunch of different symptoms. Anxiety can be both an emotional experience as well as a physical one. Most often we see this for folks who have anxiety or panic attacks. So that for many people can feel like a heart attack or can feel like something's wrong in the body, which is why many people end up at the ER when they're experiencing anxiety. So it's important to know if you have a chronic illness, when you're experiencing anxiety, it might be confusing to figure out, okay, is this just my anxiety presenting itself? Is it my chronic illness symptoms aggravating me? So it's important just to remember that. There are also other worries that might come along with chronic illness. So, chronic illnesses are expensive. There can be a lot of financial worries. You can wonder how you're going to pay for treatments or medical appointments. You can also wonder, if maybe you're not able to work, how are you going to pay the bills? That can create a lot of anxiety and stress for people. And then socially speaking, if you have a chronic illness that is something that is visible to people, you might feel some shame or embarrassment around that, and it might make it difficult for people to go out and be social if they have social anxiety about how they appear to others, or even anxieties about how am I going to feel if or what's going to happen if I don't feel well while I'm out and spending time with people. Okay, next slide, please. So in addition to grief and depression and anxiety, there are some other stressors and environmental factors that can really impact how people are coping with chronic illness. So the big thing that I'll say about stress is that people, we all experience stress, and folks with chronic illness are not exempt from that, but dealing with stress might make it more difficult to manage the chronic illness, or it might feel as though the symptoms are worse during a stressful time. There's a misconception that stress causes chronic illness. It's a complicated question, so I'll leave that one to the doctors. I would say in some cases, perhaps that could be true, and in other cases, it's not. So if you're concerned that your stress level is impacting your chronic illness or causing you to not feel well physically, that's something to talk with your doctor about. Again, financial concerns I mentioned. If you have pre-existing, medical or psychological conditions that can bring on stress, will my medications I've been on for years match up with the new medications I've been prescribed? How am I going to cope if I've had depression in the past and now I'm experiencing these new health challenges? Additionally, relationships. So, unfortunately, I've seen a lot of relationships end over the years, not necessarily as a result of chronic illness, but that surely has placed additional strains on a relationship or on a marriage. Um, so, it's important for couples who are dealing with chronic illness to really get the support that they need if the chronic illness begins to take over. Okay, next slide, please. So this is our last case study here. So Margot is a 50-year-old woman living with Crohn's disease. She's someone who needed to have a surgery called a bowel resection, which basically removes a portion of someone's colon that is been diseased or has scar tissue perhaps after treatments. And so, she's somebody who has been through that and is now taking medication regularly, and it appears as though she's pretty engaged in her life. She's able to work, she's able to volunteer and spend time with her family. She's able to exercise and watches her diet as she's able to, and sleep habits. So really, if you take away her chronic illness, this could be any one of us. She is living a pretty good quality of life and managing her chronic illness pretty well at this point in time. Okay, next slide. So there are a lot of different ways that we can manage chronic illness. There's no one, right or wrong way. I tend to think of a more holistic approach as being helpful because you have a lot of different support people involved and you're able to try a lot of different things that help to manage, hopefully, disease progression as well as symptoms. So the first piece of this is really Western medicine, and most of us have some sense of what this looks like, but I'll talk about it for just a little bit. So when you have a chronic illness, you most likely will not only see a primary care doctor, but you will also see some kind of a specialist, again, a neurologist, gastroenterologist, hematologist, endocrinologist, pretty much any part of the body and anything that could be going wrong with it has a specialist for it. And the importance of seeing these specialists are really that, these are people who have been well trained to deal with these types of conditions. So if you have ulcerative colitis, for example, and you're only seeing a primary care doctor, which is probably pretty unlikely because they would be referring you out to see a specialist. But if you're only seeing that primary care doctor is going to be seeing people with all kinds of health challenges. They might see somebody who just broke their hand, or they might see somebody who has the flu or cold, or they might see somebody who has a chronic illness, but this is not their area of specialty. And so that's the reason why it's important to see somebody who only sees people with ulcerative colitis, for example, every day. And they really have a deeper understanding of what the treatment options are, as well as just when you share symptoms with them, saying, oh yeah, my other patients deal with this too. So you can receive that validation from them. The other thing I'll mention about that is that oftentimes with specialists and with chronic illness, when you're going to see the specialist so often, I think sometimes we forget that that specialist is not the person who can deal with the other kinds of health issues that can come up. And so it's important also to keep that primary care doctor on board, because while they're not necessarily the best person to be managing the chronic illness. They are the person that you can go to if you need a referral for something, or if you have a cold, or again, if you break something, or if you start having health issues that are completely separate of the chronic illness that you're already diagnosed with. So I'll also mention nurses. So, you might end up interacting with a nurse in your doctor's office more than you interact with the actual doctor. Oftentimes, they're the ones who take the phone calls if you're not feeling well, or we answer questions about medications. So it's really great to find a nurse, if you're able to, that you feel comfortable with and safe with. Um, Additionally, if you're seeing these other providers, you might get referred for some of these other providers as well. Um, Dealing with chronic illness is not just about what's going on in the body, it's about quality of life. It's about how do you make adaptations in your life that can help you function better. It's about your, emotional, mental health as well. So, you may receive referrals to psychologists, social workers, physical therapists, occupational therapists, speech therapists. It really depends on, again, your chronic illness, as well as what kinds of additional supports might be helpful. So I'll add that often in Western medicine there are medications. So some of those medications can be used for symptom management. So for example, if somebody is having muscle spasms, maybe they'll be prescribed muscle relaxers, and similarly with other symptoms. So, these medications can help people manage their quality of life. It can help make things easier. It can help them feel more comfortable. It can help them sleep better at night or be able to eat certain things. So the medications that are given for symptom management don't take the chronic illness away, but they can still be incredibly helpful. And then for some chronic illnesses, there are disease-modifying therapies available. So medications that will help to either slow a progression of a disease down or put a disease back into remission. So it's really important, if you know somebody living with chronic illness, or if you yourself lives with a chronic illness, to be able to talk with your doctors about these options. And then finally, surgery. It's not always an option for folks, but as you saw in our case study, it was helpful for that woman to have her part of her colon removed, so that it was a healthier colon, and they could, put it back together in a way that would help her function better. Next slide, please. So in addition to Western medicine, there are also a lot of alternative options for managing chronic illness. And again, I tend to appreciate a more holistic approach, maybe somebody that's doing some, Western medicine options, as well as some alternative options. This is a personal choice for everybody living with a chronic illness. So if you know somebody living with a chronic illness and you think something might be helpful for them, it doesn't necessarily mean that they're on board with that, or that that's something that they would like to try. But I'll say, so the National Center for Complementary and Alternative Medicine, they divide alternative medicine into these 5 categories, and these can include anything from massage therapy to acupuncture to Tai Chi to naturopathic medicine to using herbs and supplements to Ayurvedic medicine. So, a number of things that, again, could be really helpful for folks living with all different kinds of symptoms of chronic illness. Next slide, please. So in addition to seeing medical providers to be able to manage chronic illness, there are a lot of different self-care strategies that people can put into place to manage various aspects of living with their illness. The thing I'll say about self-care is that there are a lot of misconceptions about what is self-care. Is it something that's selfish? Is it something that involves massages and mani-pedis? Maybe, but there's a lot more to it than that. So the very first one, ADL, so activities of daily living. I don't know if any of you have heard that term before, but this can include anything from just making sure you get up and shower in the morning or brush your teeth to taking your medicine, as it's regimented. And for a lot of people living with chronic illness, all they can do are just the ADLs, and that's okay. And I think it's a victory for somebody who lives with really intense fatigue to get up and take a shower in the morning. And so it's important to give people credit for their small victories that they're able to accomplish. For other folks, there are some other things that can be done as well. At the Center for Chronic Illness, we have a Living Mindfully with Chronic Illness support group I'll talk about. So this program teaches things like self-compassion and mindfulness, just in general being kind to ourselves. There's a lot going on in the body when somebody lives with a chronic illness, and so if somebody can practice being kinder to themselves, that's going to go a long way in how they cope emotionally with what's going on. Not everyone living with a chronic illness is able to exercise, but for those who are able, finding exercises that work for you, making adaptations. Similarly, eating a healthy diet. So a healthy diet for one person might not be a healthy diet for another person. So really paying attention to one's body and figuring out what works best. Sometimes working with a nutritionist can be really helpful for that. Sleeping enough, folks living with chronic illness, their bodies are struggling more to function at their best. And so if you're not getting enough sleep, it's going to be that much harder to function at your best. Some of the things that self-care can offer are things like avoiding toxic people. We all know those people in our lives who creates more stress or drama. So being able to really make decisions about who you spend time with and setting boundaries as you need to. Again, spending time with loved ones, people who are supportive and who are validating in what someone's going through. They're living with chronic illness. Sometimes, like we were talking about depression, if someone's feeling depressed, being able to just change your scenery, if you've been inside all day, even just going outside for a couple minutes, if you're able to, can make a difference. Next slide, please. So something else that can be really helpful in managing chronic illness is making sure someone has a good support system. So for some people, this may include family and friends, or coworkers, colleagues. For other people, it might include hiring a professional, so a therapist or counselor. For some people, there are other medical professionals become part of that support network. If you have a really great doctor or nurse, somebody that's really compassionate, that can be incredibly helpful. Support groups, which I'll talk about in a minute in regards to the Center for Chronic Illness, but there are a lot of self-led groups out there, groups led by a patient, somebody living with the illness, as well as some professionally led groups. And the crisis clinics. So, if you are in crisis, I mentioned earlier suicidal thoughts, if you're feeling really down or anxious and really need someone to talk to, the crisis clinic or the National Suicide Hotline for those listening and who aren't local here can be really great resources. Next slide. So I saw this on the internet the other day and I thought this was really appropriate. Oftentimes we see all the things that you're not supposed to say to somebody living with chronic illness. So I thought this was helpful for really wrapping our heads around what are these kinds of things. If somebody is really feeling tired, you might say, oh, you sleep too much, or I wish I had time to nap. Some people say, oh, have you tried this? Again, have tried this supplement, try it, exercise, sleep more, eat more, you're not eating the right things. So yeah, so again, helpful to know some of these things not to say to folks living with chronic illness. Okay, next slide. And I put together this infographic a while back because, again, we hear so much of what not to say. These are some really helpful tips for what you can say to somebody living with chronic illness. And the biggest tip I would say is really just treat them as though you would treat somebody else, and maybe with a little extra sensitivity and compassion. Um, okay, next slide. So just a few resources that I'll mention here. So a lot of chronic illnesses have their own chronic illness organization. So, I listed a few here: the National MS Society, the ALS Association, Crohn's and Colitis Foundation. Um, if you have a certain diagnosis, you might look and see if there's an organization associated with that diagnosis specifically. There are also organizations like WASHA, Northwest ADA Center, Site Connection, WATAP. Some of the links for these are at the end of the presentation, so make sure to check some of these out because I think they can be really helpful tools when someone's living with chronic illness, just to be aware of that these kinds of organizations and support services exist. Okay, next slide. So finally, I'll talk just briefly about the Center for Chronic Illness. So CCI was my brainchild for quite a while before we officially started in 2016. As Ingrid mentioned, that was after working with folks with chronic illness for many years. It was just something that I really thought was important in the community, and after seeing so many gaps, wanted to be able to offer this support to people. So you can see on the right here, this is a picture of our board of directors, and I'm in the center there. So right now we are a very, very small staff of one. So I am sole staff member, and I'm very part-time because I'm also still working in my counseling practice. But we do have some volunteers, and our board is fantastic, and we're making a lot happen with very little resources at this point. So I'll add that our support groups are all professionally led. So part of the model that I had put together when we first founded this organization was to be able to offer both free and also groups led by folks who understand chronic illness, who work as professionals in the community, who understand group dynamics, who can deal with difficult group members, all of that. And so our support group leaders are just fantastic, and we're so lucky to have them on board. We did offer some educational talks back in the spring. We offered a couple. One was on working with chronic illness. So how do you manage dealing with employers and asking for adaptations and resources when you're in a work environment living with chronic illness? And the other one was about coping with stress and depression and anxiety. And in the future, we hope to be able to offer more programs and spread around the greater Seattle area even more, as well as be able to offer some programs online. So we're currently looking at web-based support groups as well as webinars similar to this one. So next slide, please. So finally, these are our 4 support groups that we currently have running. We piloted 2 back in the spring and piloting 2 more actually tomorrow and Saturday. So if you're interested in any of these groups, feel free to take a look at our website, which is listed at the end of this presentation, and you can blow up these flyers a bit more so you can actually see the details of them. Next slide, please. So again, here's some of my favorite resources. This is by no means a comprehensive list of chronic illness resources, but some of these you might check out, and tried to cover all different areas of what I've talked about today. Next slide. All right, so I don't know if anyone has any questions. Perhaps Ingrid, you'll take back over here to moderate that part.
Sure. Well, thank you so much, Allison, especially looking at that last list of resources. There's so much available out there, and it's nice to have some links. And I just want to remind people that in your handout section, you can actually download that right now. We'll email it to you as well, but you should be able to click on those links. So that's a wonderful list of resources and a lot of information about dealing with chronic disease. And I think the numbers that you started with are really staggering, of all the impact of all of the people that are affected by chronic illness, and it's continuing to rise. So I think there's a tremendous resource with your center and the programs that you offer. So one of the questions that came in was, how can caregivers survive with somebody and coping with that? Because you had mentioned to me that, yes, you deal with individuals, but you also end up dealing with family members as well.
Yeah, that's a really excellent question. And it's a complicated one because as a caregiver, so much of your time and energy is given to taking care of that other person. And what I would say to that is, know your own limits and, be able to ask for help when you need it. I know that's not always possible. There aren't always resources for offering help, but, there are some respite services here in the city. So respite is, by definition, a break for caregivers. So somebody that can come in and be able to offer support, or even just a few hours of a break so you can, go sit at a coffee shop by yourself, and not be in that caregiving role. So I think that's really important. I also think, support groups. So we have a group starting on Saturday. It's called Caring for Chronic Illness, specific group for loved ones of those living with chronic illness. So, we're hoping that that can be a wonderful resource for the community, for caregivers. And, I understand sometimes it's not possible to leave your home if you're caring for somebody, who's going to take care of that person while you go off to the group. If you're able to get some respite care during that time, or even down the road, we really hope next year to have a web-based support group for caregivers. There are also many wonderful caregiving resources out there. So, if you do have access to the internet, and hopefully you do if you're accessing this webinar, but you can also, try to access some of the caregiver resources that are online as you're able to. Yeah, it's a tough situation.
Yeah, I also, in that light, had another comment about dealing with intimacy when your partner or your loved
Mm-hmm.
one is suffering with certain symptoms, and what are
Yeah.
your suggestions for that?
Yeah, that's a really great question as well. I work with a lot of different kinds of people with different kinds of illnesses, and, sometimes, the issues are around energy or pain, and sometimes the issues are around performance or inability to perform. And so I think with that, it's important to talk with people's doctors. I know for some, it's an awkward conversation, but I think, making doctors aware that that's an issue and being able to, see if there are any things that can be addressed medically, as well as, maybe resources such as, going to see a couples therapist or a sex therapist that could be helpful with that as well. But yeah, I think as with anything in a relationship, it takes communication and prioritizing, and being able to make the time to be honest with one another about it.
Okay, and I think you just talked about sometimes some people may not feel comfortable bringing up things with their providers, but one
Mhm.
question that you mentioned to me is one of the most common things that you get asked is talking to your medical provider, and when you have maybe a specific unmet need, how do you get your medical provider to communicate with other medical providers? Like maybe you need to see a different individual. What can patients do about that?
Yeah, that's a great question as well. I think oftentimes, we all know doctors are busy, nurses are busy, and so I think sometimes it's about not wanting to bother them or feeling afraid to ask if it is a difficult question. But I think being able to say, hey, this is my body, this is my diagnosis, it would be really helpful to me if you would be able to talk to so and so over here who's also trying to treat this same problem. So, for example, if you're seeing a naturopathic physician as well as a Western medicine specialist, being able to encourage those two to talk. Typically I find that doctors are willing to do that. It's just a matter of them needing to know that that's something you're interested in. But if you really find that they're struggling with that, you might just try to understand more about why they don't want to. Is it that they're too busy? And if that's the case, how can, you help? Is there a letter they could write or, a form they could fill out? To be able to share that information, and sometimes even just sharing records among different medical offices where you're seeing different professionals can help with that communication as well.
Okay, so I think also you're mentioning just mention it. A lot of uh,
Yeah.
patients or individuals may not even bring it up, so that can
Yeah.
probably help facilitate things, just even talking to your provider about that. Um,
Yeah.
and sometimes our visits are rushed, so
Yeah.
we're thinking about. Well, I think we are just about out of time here, so I'm going to wrap things up. And we really welcome your feedback. Immediately after the webinar closes, you'll have a quick survey. We sure would appreciate it if you could fill that out for us. And following the webinar, uh, we will make a recording and upload it to our website. So that will happen in about a week. And also, you will get the email with the slides and the resources if you weren't able to download them. So for today, I'd like to especially thank our speaker for a tremendous amount of information and helpful resources.
Thank you.
And appreciate your time today. And also, I'd like to thank my co-facilitator, Karen Vogel. She's been monitoring the chat and the questions and anything that's come up. And I'd like to note that Karen is an independent patient advocate, and she is going to be presenting at our next WASHA event, which is October 23rd. It's a Facebook Live question and answer about health insurance and the upcoming open enrollment period, which starts November 1st. And there's quite a bit going on with health insurance, so that should be very interesting. So submit your questions. Just go to our website at washa.org and go to events, and it'll bring up that event and you can submit your questions. And you can also look at our other webinars. So I think, Allison, your webinar will be a great resource for people.
Thank you. Thanks.
And
Yeah, thanks so much for the opportunity to speak to all of you today.
thank you. So, and thank everybody for attending today. And I hope everybody has a wonderful rest of the day.